Hello students, how have you been? I hope all of you are doing well, especially during this pandemic time. I know it's very hard for all of us. Okay, so stay safe, stay at home. And for today, you will learn about health issues related to the human nervous system. In this subtopic, there are two learning standards. Okay, so at the end of this lesson, you should be able to communicate about the health issues related to the nervous system and describe the effects of drug and alcohol abuse on human coordination and response. The first health issue is multiple sclerosis. So a multiple sclerosis is a progressive disease as a result of an abnormality in the immune system that attacks the myelin sheath in the brain and spinal cord. Therefore, the transmission of impulses to and from the brain is obstructed. And people who are suffering from multiple sclerosis slow down in their movement. Alzheimer's disease is caused by the degeneration of neurons in the brain due to aging. This disease causes the loss of ability to reason and to take care of oneself. This patient usually confused, forgetful, and disoriented, even in a familiar place. In other words, this person suffers from intellectual impairment, memory loss, and disorientation. If the deterioration of the brain continues, the patient will lose the ability to read, write, eat, walk, and talk. People who are suffering from Parkinson's disease experience tremors in the limbs, jaw, foot, and face. The patient will also have difficulty maintaining body posture and balance. This is due to the insufficient production of the neurotransmitter in the brain called dopamine. Dopamine is important for movement control. For amyotrophic lateral sclerosis, or in short forms ALS, is a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord. So this disease is caused by the deterioration and death of motor neurons that control the movement of muscles such as chewing, walking, and talking. And then for attention deficit hyperactivity disorder, or ADHD, is a type of brain disease that causes someone to become hyperactive. The patient unable to concentrate and gets easily bored. So ADHD actually is a condition that affects the mental health. Autism is a type of disease related to the development of nerves in the brain. And autism causes an individual to experience problems communicating and interacting. An autistic person has difficulties with verbal communication, has repetitive behaviors and lack of emotional expression. Brain paralysis or cerebral palsy occurs because of brain damage before or after a baby is born. Okay, and it could also possibly occur in children between the ages of 3 to 5 years old. This disease causes failure in muscles and the ability of motor neurons to function properly. Therefore, it affects a person's ability to move and maintain balance and posture. Epilepsy is characterized by seizures caused by the sudden discharge of electrical charges in the neurons. Okay, and the occurrence of abnormal activities in certain parts of the brain causing the nerve cell to produce unusual signals. Okay, and a person suffering from epilepsy maybe become unconscious and experience muscle spasms. Now, let's take a look at the effects of drug and alcohol abuse on human coordination and response. There are many types of drugs used for medical purposes. For example, marijuana is used by doctors in small quantities to reduce nausea in cancer patients after undergoing chemotherapy treatment. However, drug abuse other than for medical purposes can cause serious side effects. Can cause serious side effects and would most likely be fatal. Drug abuse is taking drugs excessively without a doctor's prescription. So among the effects of drug abuse on drug addicts are addiction. And an addiction that causes withdrawal symptoms such as shivering, sweating, and vomiting if the drug is not taken. Overdose of drugs can also lead to brain damage and mental problem. This table shows drugs and alcohol and their effects on the nervous system. For stimulant drugs or stimulants, it increases the activity of the central nervous system. And excessive use causes temporary euphoria, which is followed by depression. So what is euphoria? Euphoria is actually a feeling, or state of intense excitement and also happiness. Next, sedative drugs or depressants. It delays the transmission of nerve impulse, and calms the mind. In other words, it slows down the activity of the central nervous system. For hallucinogenic drugs, it causes the user to hallucinate, and relief from pain and anxiety. Intense distortion in a person's perception of reality causes hallucination. Narcotic drugs, it delays the normal functions of the brain. And lastly, alcohol. It disrupts coordination and thinking. and also delays the transfer of nerve impulses. So the reaction time and coordination of person who consumes alcohol will be slower.